Good afternoon. Welcome to CAI's live question and answer webinar on COVID-19 and community associations. Questions about opening community association pools. My name is Dawn Bauman. I'm CAI Senior Vice President of Government and Public Affairs. I'm so grateful that you are joining us today. We have about 1,000 people on the line today. If there are technical difficulties, please go to the control panel on your screen and pose a question or post your technical difficulty question on that question box. We'll also use that question box for the live Q&A that we'll be having the later part of this session. I would like to thank our presenters who have joined us today, our panel of experts, Wendy Taylor, who is a large-scale community association manager right here in Northern Virginia, Ben Basch, who is in New Jersey and is the Chief Development Officer, is that right, for American Pools, covering a lot of different markets throughout the country, especially here on the East Coast, and Scott Carpenter, an expert community association lawyer from Arizona. I can't imagine that you're not having pool issues in Arizona, Scott, since you've already hit 100-degree temperatures. The purpose of today's call is to provide you community association leaders and managers with information and tools to help you put in your toolbox as you contemplate opening your pools and keeping your pools open and communicating with your residents about the status of your pools. While we have unbelievable experts on the panel today, including a lawyer, the purpose of this webinar is not to provide you with legal advice. We don't know the circumstances in your community. They don't know the circumstances in your community, your residents, your promises, your locality codes or state restrictions. So just take this information as part of the piece of the puzzle to help you make good decisions moving forward. As you see, we're using a platform called GoToWebinar, which allows us to have some interaction with our audience members. You'll be able to pose questions throughout this session, and during the second half of the session, we will be answering those questions for you. There's a question box. Feel free to click on that question box, put your question in there, and we will get to as many questions as we can later in the session to try to address your questions. I want to just check in with Scott, Ben, and Wendy. Is my audio okay? Are you hearing me fine? Okay, well then I'm sure your audio will be great. I want to thank you for participating with us today. As I mentioned to you earlier, I'm going to turn my camera off to put you guys on spotlight and turn it over to you. Thanks for being with us. Scott, why don't you get us started?
Sure, Dawn, thank you. The main question that we'll use to kick this off is, does the community have to open the pool anytime soon? Does the community have to open it when and because the law requires it, or because the residents are demanding it? This is one of the challenges that we have in community association governance, is the clash between the law and politics. When the owners are coming at the board with pitchforks demanding that the pool be opened because that's the summer routine, and parents are tired of the kids being in the house and trying to fake it through some semblance of homeschooling, because that's what the expectation has been. When is the pool going to be open so that the routine can change? And this is the challenge for many boards across the country. In Arizona, we've already had 2 straight days of hitting 106, which tied a record yesterday for the highest temperature on that date on the calendar, which is a bit of an obsession here in Arizona for the highest temperature on a particular date on the calendar. So we're already getting this question, and as you can imagine, law firm of any size is going to get this question multiple times in a day from any number of clients. And in our state, the governor has not indicated that pools can open. And so, the biggest question is, when can a board feel safe opening the pool once the governor says that it's okay? and what role does it play when the owners are demanding it? And of course, this is ultimately a decision for a board to make, because the board is not obligated to open the pool simply because the government says that it's okay. I mean, the board could keep it closed, and that's what we're telling our clients, is that there is no law that says that in the current environment where a public health issue exists, regardless of whether the government says that it's okay to open it, the government's not saying the public health crisis doesn't exist. The board could make the decision to keep it closed. And I suppose in theory, an owner group could file a lawsuit saying that the board is obligated to open it, but that would seem to be a bit of a stretch legally. And I'm not saying that in your state that wouldn't work, or that the board would have no risk, but you know, in the current environment, it would seem to be difficult for an owner group to file a lawsuit saying that the association's obligated to open the pool. So our view is that it would be very difficult to compel an association to open the pool, and that the board really has the option. One of the things we're going to talk about in this webinar is one of the challenges that's created by insurance on a going forward basis. Ben, what are you seeing?
I kind of wanted to backtrack a little bit in terms of, you know, especially in the seasonal markets, you know, what opening the pool means, because we get caught up in semantics sometimes. You know, Scott, you're certainly in a year-round market where, you know, it's you know, the pools are operating 12 months of the year typically. And in the Northeast, you know, certainly from Virginia and north, these, you know, the pools have a seasonal aspect. So when people say opening the pool, there's a distinction between opening the pool for use and preparing the pool and maintaining the pool. And my guess is out in Arizona, the contractors are still maintaining these facilities, but they're at this time not open for use. And, you know, it's important to make that distinction, because as moving forward, as there's opportunities to open facilities for use in the seasonal market, if they're not already up and running and being maintained, you're really pretty far behind there. There are a couple things that I, you know, some risks of not maintaining the pool, whether you're in the year-round market or in the seasonal markets. You know, there are public health risks associated with not maintaining the pool. So even if the pool is not open for use, there's a responsibility in these warmer temperatures to get that water circulating, keep it sanitized, because there's potential for mosquito infestation, and then risk of, you know, West Nile and Zika. We don't need to trade one issue for other public health issues. So we're really trying to make sure that we don't lose sight of those aspects. And then, of course, there can be damage to the facility itself if it's not maintained. So, you know, at minimum, we're talking about sanitizing, circulating, and maintaining regardless of use. Then there's the whole separate question about, you know, opening it up to bathers. So I think, you know, in terms of, you know, when does the association, you know, have to open the pool? I mean, you're talking, you know, is it even permissible? You know, can we open it? And I don't know, Scott, kind of back to you. You could talk a little about that.
Yeah, in the question of can we open the pool, the guidance that CAI is urging all community associations to comply with is always comply with federal, state, and local orders. And it would never be CAI's recommendation that an association violate any stay-at-home order or any governmental order in terms of closure. And so always be aware of and mindful of whatever those orders might be. And some states have a patchwork. You may have a governor who has taken a particular position, but then you might have a county or a city that has a further refined position. And if your association has those multiple levels where the city and the county and the state all have a position on this, then sometimes just figuring out exactly what the regulation is in a particular instance could be a challenge. And in many cases, it's not a nuclear secret. It doesn't require a lawyer. It sometimes simply requires being able to go to a website and simply read it. These kinds of public health orders are intended to be able to be deciphered by the average citizen and are not written with the purpose that they can only be deciphered by a lawyer who has passed the bar exam and has the secret bar exam secret decoder ring that only we have when we get our license to practice law, and that only we can read them. I'm kidding, there is no such thing, of course, but the goal is that any director, any officer, any board member, anybody, something in my throat, I'm not sick, obviously, that could go to a website should be able to figure out what is the closure order in your area. And so it shouldn't require any kind of legal fees necessarily to figure that out. But that's the number one issue, is the can we open? And then we've got to figure that out first. And the real issue is compliance. And can we do it in a way where we're compliant with those restrictions? And then is there a way to do it that also complies with public health recommendations? And whether that's the CDC requirements, we'll leave it to Wendy's got some good ideas here in terms of how this could happen, some of the distancing requirements. I've developed a bit of cynicism over this period of this pandemic over the term social distancing, because in fact, the better terminology would probably be physical distancing. It's social distancing is the right word, I suppose, because that's what we've all come to use. But technically, we're supposed to stay away from each other. It's a physical distancing requirement. And as a professional community manager, Wendy's got some good ideas on that. Her community's got some inventive things that they're doing, so we'll pitch it to her here in a second. But Ben, what else are we doing on the can we requirements in terms of some of the things that are happening in some of the states you're operating in?
Yeah. So, as Scott's saying, you're going to have, obviously there's federal order, then there's the state, and then, it drills down beyond that. So a good example would be right now in Texas, you go to the Texas website, the governor has an order that it is open, it's permissible to open community pools as of midnight tonight. But when I talk to our operation in Houston, the guidance further down the line is, hold on a second, we're not ready. And along with that, even at the state level comes an adjustment of the maximum occupancy in the pool area. So for instance, at the state level in Texas, they're saying you've got to get down to 25% of your normal maximum capacity. So as these different, whether it's state making the rules, and then it's additional rules coming in through the local health, the closer the local health authority, you're going to kind of end up with this like piling up of requirements as it gets more and more granular. So I know in Florida, we have pools open in Palm Beach and Broward counties right now. It is permissible to open, but all these openings come with strings attached, and they are going to have additional requirements that have to be met. It's not just open the pool same as usual. So in terms of rules about where the furniture is placed, rules about I know in Florida, Palm Beach and Broward, there's mention that you have to have somebody on premises to manage the maximum number of people in the pool area. So it's not you get open, it's okay, and it's just like normal. There are additional requirements that come with it. And I think, Wendy, you've got some specific examples, and and going into the, actually before you even get to that, I don't know, we talked about the insurance.
Well, one of the things that we've heard a good bit about is the exclusions on the CGL, commercial general liability policies, for these infections and from microbes and from viruses. And there have been a number of infections going back to the early 2000s that have spread across the world, and insurance companies have done a good job from the insurance company's perspective of excluding any liability claims that arise from these kinds of diseases. And so what we're hearing from the insurance brokers and the insurance companies in particular is that these exclusions have been attached to nearly all of these policies. And when you're shopping for insurance as a community association and you go to your renewal, it's not the kind of thing that comes up on a routine basis. In 2015 and 16, 17, 18, when you were doing your insurance, I doubt very many directors said, now what's the coverage for pandemics? And so the fact of the exclusion probably didn't come up. And so when the brokers and the carriers are saying correctly, we assume correctly now, that these claims are likely going to be excluded, we have to be aware of the fact that if you open the pool and someone contracts COVID-19 and they go home and they assume or believe that they contracted it because of the way that you managed the pool, because someone was sick at the pool, and they sued the association because of your pool practices, and that's the reason that they died. They infected their entire family, and then multiple other people got sick, and then they had a July 4th celebration, and then multiple other people got sick and died. That lawsuit against the association, when you receive it and you tender it to your CGL carrier, there's a good chance they're going to deny coverage based on the exclusion. And that doesn't mean that the association's off the hook. The association is still being sued. That may still go to a jury, and the jury may still decide that the association is legally liable, and the jury might say the association owes the plaintiff, let's make up a number just for the sake of discussion, the jury might say that the association owes the plaintiff $10 million. All I've said is there's no insurance to pay it. Doesn't mean that the jury is prohibited from concluding that the association isn't responsible for $10 million to the plaintiff. It just means you didn't shift the risk to an insurance company. Doesn't mean you're not legally liable for it. You just didn't move the risk to an insurance company for the payment of a premium. There's no risk shifting. So we've got some major issues here with liability, and there are some associations that are seriously contemplating not opening the pool at all because of the fact that there may be an impossible scenario when it comes to shifting the risk of liability. If there is no insurance carrier who will accept the shifting of the risk of liability due to disease when opening the pool, because this quantity of risk, we'll call it the COVID-19 risk of opening the pool, cannot be commercially shifted to an insurance company because they all say we will not accept that risk. There is no premium high enough for us to accept that. Then an association might say, it's too big a risk. We're not opening the pool at all because there's a quantity of risk that exists with opening the pool that cannot be shifted commercially in the existing insurance markets. And under those conditions, those risk conditions in the current market, we would rather not risk someone getting sick and being sued by a plaintiff attorney. And it may be that it's just a matter of time before the attorneys start advertising on TV. Do you believe that you got COVID-19 in a public place because of a lack of sanitation? Was it a restaurant? Was it a public pool? Was it your condominium pool? And those attorneys might decide, because they normally chase insurance. I mean, you look at the attorneys who advertise on TV, were you hurt in an accident? I mean, they're chasing insurance policies. That's all they do. I mean, that's the game they're playing. And they may say, well, maybe it's not so bad to chase $1 million claim against a condominium association for reasons that I won't get into in this call. $1 million judgment against a condominium isn't so bad, actually. And they may decide that maybe it's okay to chase $1 million claim for liability against an entity that screwed up COVID-19 protection on a pool situation if there's no insurance. Okay, so you got a judgment against a condominium for $1 million. There was no insurance, but maybe they'll figure out how to collect that from the condominium later. So I'm not telling you what to do.
I have a question for you, Scott. This is Dawn. Sorry to pipe in, but what about, we talked about this, and I know we'll get questions about this. What about a waiver? What if you have residents sign a waiver? And then maybe we'll move on to Wendy after this, but I think that'll be a good question to answer.
Yeah, we have a number of clients who are having us draft waivers, absolutely, because of this very problem. And the clients who are having us draft waivers are running into a couple of problems. One is, in Arizona, there are a lot of associations that have unmonitored pools that are not connected to clubhouses that don't have personnel. And so they're having trouble figuring out a gatekeeper process that would allow them to monitor whether somebody's actually signed the waiver. And so, you know, for a lot of you that have big master plans, Wendy, you've got 5 pools, you know, you've got a big operation where you can gatekeep this maybe a little bit better way, but some of them, it's hard to imagine that. And then one of the other problems is every state's a little different about whether you can get a waiver for gross negligence. Can you get a waiver for a child's claim? There's all kinds of nuances to whether a waiver can actually fully protect the association in a certain scenario. So it's a great question, Dawn, and it does somewhat solve for the problem I'm talking about. Good point.
Yeah, thank you. Wendy?
So we've talked about could we, but should we open our pools is the question that really your board needs to discuss, because you're going to have to be expending much more resources. You're going to look at your state guidelines right now in Virginia, as an example. You can only have 10 people congregating together. So am I going to open a pool with a capacity of 500 for 10 people? What's the financial equation there? Palm Beach County, Florida, they're having to log everybody who comes into a pool and video them and provide those records to the county. So that's very onerous, and you may just not want to do it. And who's going to enforce it? Luckily, in the big pool areas, especially in the Northeast, we have guards, but our guards are for the most part, teenagers or early 20s. They're going to have to try to enforce not only entry, which they have to do all the time, but also the social distancing of non-family groups. And so we're going to have to increase our amount of guards. and as best they can do, have these young guards enforcing it. So you need to look at what your state is telling you or your county is telling you to do. In our situation, we have to have county permits from the Board of Health to open. So we may not even get this. We're inspected and have permits issued. So there aren't really too many guidelines. We did find some CDC guidelines on cleaning, not necessarily specific to pools, but we've also been cautioned that we shouldn't make a representation that we've disinfected any pools, because we're not disinfecting experts. So those are all exposures. Definitely talk to your attorney, talk to your insurance carrier to see if you do have some kind of coverage. I spent a while with our insurance carrier yesterday, and we came to a conclusion of what kind of coverage we do have. Ben, I think you're going to talk to specifics.
Yeah, I mean, I was just going to kind of chime in terms of, you know, when we're talking about the pool area and what the actual risk is, you know, when you read through the CDC material, and there's actually a specific mention of pools and hot tubs on the CDC website, where they make it, you know, very clear that there's really no risk of transmitting the virus through the water as long as it's well maintained. And that's really just following the normal health department requirements, because, you know, there's every season there's viruses and things being, you know, around, and that's why we sanitize the water all the time. So the chlorine doesn't care if it's COVID-19 or, you know, hepatitis A or whatever else is out there. I won't tell you everything that's out there. You'll never swim again, but that's why we sanitize the water. So the risk is, it's still a person-to-person risk and a surface-to-person risk. So, you know, in the pool area under the should we, I think there's going to be a lot of pressure from communities. I think there's going to be a lot of interest in the outdoor pool areas because of the common areas. It is, in my opinion, it's a lower risk. I'd rather be at the pool than in an elevator. You know, I'd rather be, not that the elevator is an amenity, but, you know, maybe for some people, but, you know, or in the, you know, some parts of the lobby or, you know, other, you know, the fitness room where, you know, you're enclosed, you know, I'd much rather be out in the pool area. So I think, you know, under the should we, if you look at what the local health authority is saying comes with it, if it's doable, you know, I think there's going to be a lot of interest in doing it, just given the fact that it's not going to be transmitted, you know, through the water, which is the bulk of what people are doing there. You know, then there's considerations of furniture, there's considerations of the restrooms, just like any other, you know, common area.
Hey, Ben, did you hear anything last night on the news in DC? They were saying that the virus can only live for 3 minutes in direct UV light, which sort of changes the formula for our having to worry so much about chairs. Have you heard anything about that?
You know, I'm hearing it's I think we're going to hear more and more about that, and we're going to hear more specifics about it. You know, I've read, you know, articles about this study. I didn't see the Washington DC report that you're talking about, but I think you know, we know that UV has UV radiation does have sanitizing properties. The question is, what's the kill time? If it's 3 minutes of direct sunlight, I think that bodes very well in terms of the risk associated with coming into these outdoor spaces. You still, obviously, there's going to be the social distance, or you know, that will be required, and less, you know, lower capacity at the pool to help mitigate the person to person. But to have, you know, the sun working for us in terms of sanitizing the furniture is makes a difference. I don't know though that it would completely eliminate the need for some additional cleaning of the furniture because what if it's a cloudy day? What about the backs of the chairs? Somebody moved the chair and they're that's underneath. What's up with that? So I think it helps, but it's not the total, if that makes sense. Great point.
Hey, Wendy, let's transition to the scenario. So you have an amazing scenario that you can kind of talk through with specific steps for people to consider.
So we are not even considering a possibility of opening till what Virginia says is phase 2, which only is allowing 50 people at a max to congregate. So we're going to remove at least half of our pool furniture, and we're going to have a COVID cleaning done on all our bathrooms. We're gonna, we have pool passes, so we can regulate who comes in, but we're going to schedule appointments on 2 hours at a time. So we're going to allow the folks in for 2 hours, then they all have to leave. We clear the entire pool as if everybody has to come off the deck except for the guards, and then we clean. We are going to have extra attendants there to help with the bathrooms because the guards are not necessarily experts at cleaning. I'm sorry. So we are looking at an advanced reservation policy. At this point, we're pricing software to do this, but we will allow 50 people who have valid pool passes to register in 2-hour increments. We're going to also mark the sidewalks outside the pool with 6-foot tapes so that we're giving guidelines for social distancing while they're in line. That's going to be a cue to the children who are very anxious to get in and are pulling on their parents' hand so they can use that line to help explain. Taking every opportunity to facilitate social distancing. And then we're going to have a plan, an SOP on how to handle the situation if one of our guards gets the virus and we have to quarantine it. So there's so many different things coming at us, but we have to be prepared because if we lose all our guards, no matter how big my pool company is, to the virus, we're going to have to shut down for 2 weeks. So all these things and how to communicate them are going to be a challenge.
Hey, Wendy, before you go on,
yes.
I have a question for you. So we talked about this a little bit. First, I want you to think about if you can give us an idea of increased percentage of cost, right? So if you had budgeted X dollars for opening your pool, have you done any forecasting on what percentage of an increase of your budget you might be looking at to actually open your pools with all of these pieces in place?
I would say that it's about a 25% increase if we opened all our pools. But what we're doing is we're recommending to our board and our recreation committee, because we are in a unique position of having 5 pools, to only open 2 of them and take all the staff that we normally would have and move them to the 2 pools that are open so that we can have many hands on deck. So that is our plan.
And you talked about that every 2 hours kind of switching and having a new group of people. And I think maintaining that, making sure that the chemical level is the right level in the pools, and also looking at opportunities for cleaning during that time frame. Is that something that you were considering implementing every 2 hours?
Yes, we are. I mean, the checking the chlorine levels in the pool is done regardless of whether COVID's out there or not. And the cleaning of the bathrooms is done hourly, but we're talking about a deeper clean every 2 hours. We're having an hour break between each swimming session.
Excellent. Thank you.
You're welcome.
I want to mention, you know, that because this is a large scale facility, but some of the things that Wendy's talking about also apply to, you know, even single guard environment where you can reallocate some of your hours to concentrate them on certain days. So it may, like a strategy might be, you know, instead of the pool being open 7 days a week, you might be closed on Monday and Tuesday. You've got you know, the budget for the season. Move those man hours to where you want them, and look to see if that will help you, you know, meet the compliance, the additional requirements to comply, you know, this season. So just kind of taking what Wendy said, bringing it to a different type of scenario, same concept.
Also, actually, Ben brought up something when we were talking before the webinar, that when he first said it, I was like, how are we going to get away with it? And then as I talked to my rec people, they decided it was a wonderful idea, that possibly at one of our pools, we have our residents bring their own chair and we take all the furniture away. And at first I was taken aback. And then as we thought about it, we thought, wow, that is a great idea. So we may implement that at one of our pools.
Well, the thing is, anything that you add into the environment that's for common use becomes an additional responsibility for the association. So it's
Okay.
like every element that you take for granted is another responsibility. So depending on your situation, if you can remove some elements, you lighten your load for sure.
Absolutely.
All right, Scott, let's talk about contracts. What kind of contracts should be reviewed and considered, contemplated here? You're on mute, Scott.
You're very good about that, reminding us to be muted when we're not talking, and I knew I was going to mess that up. You know, in Arizona, we don't have very many. I mean, we have a lot of associations that don't have lifeguards, and so for a lot of people that don't have them, I suppose this is a good opportunity to revisit that. And so the cleaning, the lifeguards, the guards, if that's going to be the new normal here, that in order to comply with these restrictions, and although the cleaning is not necessarily a restriction per se, but it may be a standard operating procedure, it may be a requirement to comply with the CDC requirements. And I like what Wendy's doing in terms of taking a break to do the cleaning. It may be that that's the only way to adhere to any kind of standard system to be compliant with any of these recommended procedures. You have to have additional personnel, and there will be some associations where the board members will say, well, shoot, I can do that. I can be out there and I can put on the gloves and I can spray things down. But as a practical matter, that's best to be hired out. And so those are the additional contracts. And, you know, maybe the pool company can find those people, but that's not been my experience that that's a standard part of the pool maintenance contracts, at least in some parts of the country. Ben, you're doing that as part of your service. You've got these additional personnel that you're including.
Well, I wouldn't say including. I think that where we can, if we can provide in some markets there we would consider like an attendant market where there's, you know, we're providing a pool attendant that's not necessarily guarding the pool, but they're tending to things, you know, around the facility. And in those cases, those individuals, you know, could potentially do, you know, some of the cleaning because they don't have their primary responsibility guarding the pool. I think also, you know, there will be an opportunity to, add staff for under certain circumstances where we can support the associations by bringing in some additional staff to do those functions, more, putting them in an attendant role or a compliance role to keep up with everything. But again, it's going to come down to the budget. Money is always an object, but I'd rather have 5 hours of healthy pool time than 10 hours of anything goes. So I think it's worth the trade-off in a lot of cases for a lot of associations to kind of rework things. Maybe they will spend 10% more. They may not have to go to the full 25%, or maybe they can keep on budget by changing their days of operation and so on. So
hey Ben, so we have about, I want to wrap up our Q&A piece and go to the live piece in about 5 minutes. So here's how I want to proceed. Ben, I want you to talk a little bit about lifeguards, their primary role, and kind of what you're talking about now, but expand that a little bit to talk about what the lifeguard's real role is there and what other people can be doing. Following that, Wendy, I want you to cover 2 things. I want you to look at the rules and regulations, what new rules and regulations might need to be implemented. And then 2, let's start running through pretty briefly communication with residents. Does that sound good? All right, Ben, you're up, and then we're going to follow that with Wendy.
Okay, in terms of the lifeguard, regardless of what's going on, all the other responsibilities, safety is always their primary responsibility, okay? When they're guarding the pool, that is, that requires 100% of their attention. So we don't want to see, I think sometimes with some clients we'll hear something like, oh, well, the guard will just do it, the guard will just do it. If it's a single guard facility, or if there isn't ample staff to tend to it, then that's not realistic. So let's not forget that we can't just dump this onto the lifeguard, because 99.999% of what they do is about preventing accidents and keeping everybody that's in the water and in the pool area safe from just normal injury. That said, depending on how the contract gets set up and whatever the plan is to meet any additional requirements, they can play some role. So in Wendy's example of, kind of having these 2-hour sessions at the pool, think in terms of, people are coming to the pool for an appointment time. The guard would say, okay, I see you're reserved, you're on this list, come on in. And instead of them just jumping in the pool, they're going to get situated. Then the guard will let people know it's okay to swim. At the end of that swim session, whistle, get everybody out. That's the time. Do you have that hour to kind of reset and prepare for the next group? So it can be a lot different, than a normal summer. But those are just a few of the additional ways to use the staff on hand. Just remember, they can't do that. You can't be checking passes and guarding the pool at the same time.
Wendy, you might be on mute.
You are correct, I was. So one of the things that we're going to propose is no guests during the 2020 season. We just can't handle it. We already have our residents trained that if we're going to have an event at the pool, like a glow after dark party with our children or last day of school, we don't allow guests to allow our homeowners to get in. So there will be no guests. They're not going to be permitted to have pool parties where they have 6 or 7 kids for pizza in the eating area. Games are out, and pool hours, as I said, are going to be heavily restricted. One of the things that we did talk to our attorney about was talking about vulnerable people. We're avoiding that. You decide if you're vulnerable. We are not experts on that. So one of the other things we are going to have is a clear agreement that we are not the guarantors of your safety. that you could be exposed to COVID-19, and you are responsible for your, we're doing our best, but you are responsible to live up to our new rules, or we'll just remove your pool privileges for a period of time. And luckily, we do have the ability to do that in our governing documents. If I was back in my Florida days, I don't know how I'd deal with it, because you know, we had village pools that were totally unmanned, and they did have a little lock on the gate that anybody could get in, really. So it's
What
going to
about
be
aerobics classes and other water therapy classes? Are you allowing that to happen?
well, no. We may allow the aerobics back if we can limit how many people are participating, the water aerobics, because we can space them out. But and we're looking at swim lessons. I don't know. Right now, we're saying no, because we don't know how a guard teaches somebody how to swim without touching them. And so we're holding off on that. And the most we'll allow them to teach is 2, but right now we're not having our pool company take reservations for swim lessons. And we'll see what the governor says, but we think that's an exposure. It's not necessarily the community's exposure, because we have our pool company doing the swim lessons, but it's an exposure to the public health.
Let's talk about communicating with residents, and you can provide some insight, and Scott can follow up in some of the experiences he's having with his clients.
Well, right as we speak, our magazine that goes out to 7,000 homeowners is on hold. We're supposed to hit the presses tomorrow, because we don't know where we are with the pools, and it's filled with all sorts of information on pool passes, etc. We do weekly email blasts. We have a Facebook page. We direct everybody to our website. We have a mass text ability to the community, but not every community has that. So obviously Facebook, most associations have, and a website of some sort they have, and you need to keep that current and updated so that folks are they're going to be looking towards that. I will tell you that you can order a pool pass online at our community, and we are getting requests daily. So folks are not in the mindset that the pools are not going to open.
Yeah, I think I was just say that this communication piece is a big deal, because one of the challenges will be that if it's mishandled, it will be the fodder for community revolt, where sometimes in communities it's the Hatfields and the McCoys. You don't remember how the fault line started, where one side of the community hates the other side, or where the board split in 2. And this one might be one where we remember it was the pool issue where the board split in 2, and the community got mad at itself, and half the people were upset at the other half. And we may remember the summer of 2020 was when it all started, and half the community was upset about the pool, and the other half, wanted it closed, and half the community was upset at the other half because they wouldn't wear masks on their walks. And this is one where we can avoid all of that with good communication. And what I would hope as an attorney is that the communication would have the hallmarks of good communication. The association cannot guarantee that no one will get sick, and the association can't guarantee that its common areas will be COVID-19 free, and swim at your own risk, that kind of stuff. And I think that's going to be really important as you go forward. And getting a good advice from professional community managers, management companies, and pool maintenance folks in these communications is going to be important. And we're also encouraging our clients to have good signage at the pools. We haven't talked about that much, but there is a good sign out there that says the association is not ensuring, ENSURING, not ensuring that this pool area is free of contamination from COVID-19. That's an important disclaimer on the sign as people walk in. That's important too. Dawn.
Excellent. All right. Scott, Ben, Wendy, thank you so much. We're going to go to the Q&A piece of the program right now. So thank you so much. Really appreciate it. You guys have done a great job in giving this information so succinctly and so quickly. How do you suggest boards handle enforcing or not social distancing at the pool? Wendy, let's start with you. You're on mute.
2 times I'm out, right? One more I'm out.
That's okay. I do it all the time.
We are going to allow 1 warning, and then we're going to pull your pool privileges for the week.
Who's enforcing it?
Well, the guard will give the first warning, and then when we're pulling the pool privileges, it's going to be the general manager, because I'm the only person who has the authority to do that other than a guard, and we don't want to put the guards in that position. So I'm hopeful that there'll be a lot of peer pressure, and there usually is, for the behavior to improve. And then if it comes to that, I will bump them from the pool and they can appeal. We have a whole due process where they can go to the board and appeal suspension.
So what about families?
hardball.
But what about families? So what if, how do you know who's a family, who's not a family, and enforcing social distancing?
That our philosophy is that we can tell from the pool passes, because they're all tied to an address. Now, because that's how our pool pass system is set up, so we know if they all live in the same house, they're a family. So as they are checking into the pool, you can see that on the screen, and if it looks very unlikely, we will interfere. But we, in our regulations, we actually said social distancing, chairs will be 6 feet apart, except residents from the same household. So that's one of our new rules that we are proposing for this.
Okay,
that's
excellent.
how we're going to deal with it.
Scott, I have a question for you. So assuming that the closing and opening of a pool requires a board vote, or not opening the pool requires a board vote with a notice period for that meeting and board vote, and the board's not allowed to meet, how are some of your clients handling this type of situation?
Well, we've had a tremendous amount of boards doing their meetings by Zoom and having owners participating in open meetings by Zoom, which seems to be working pretty well. So that hasn't been too much of a problem. I did want to comment, though, quickly on this question earlier about confronting people about the social distancing. As a lawyer, that idea of confronting people at the pool for being too close to each other, that scenario of the association sending an agent of the association, whether an employee or a contractor of the association, to tell people that they're too close to each other, that feels like a lawsuit waiting to happen any number of different ways. Telling people that they're too close to each other, not only is it an opportunity for people to scream at each other and to erupt in anger, which is uncomfortable and messy interpersonally, and an opportunity for F-bombs and discomfort for all the other people at the pool who are there with their children, which is never fun for anybody. But I've had a number of lawsuits over the years, 25 years doing this, where it all started with somebody who had the great, big, good idea to go have a conversation with somebody who was doing something wrong at the pool, and it ended with an arrest, it ended with a lawsuit, it ended with an injury, And I've developed the idea that the good intentions of, I'm just going to go say something to them because they're doing something that's against the rules or wrong. And I'm not saying you should let everything go, but whether it's a glass bottle or some other misbehavior at the pool, the percentage of time where somebody says, I'm just going to go say something to them, the percentage of time where it turns into a horrible mess of a legal problem tends to be kind of high in my mind, in my experience. And my gut tells me that if we're going to treat people being too close to each other, because I can tell from here that that's less than 6 feet, especially the way people are behaving in some states over going to the Capitol with guns because they're offended because they think it's too much regulation over, you know, social distancing or whatever. I mean, my goodness, I'm worried about that. And I'm not saying, Wendy, you're wrong in the way you're approaching it, but in general, I'm quite nervous about associations confronting people for being too close to each other.
So let's talk about can you create different sections, not of the pool, but on the pool deck and pool area for different people? So senior citizens over here, children over here, families over here, adult swimmers over here, not different times, but different sections so that you're kind of categorizing these vulnerable populations. Scott, Wendy, looks like you both might have something to say on this one.
I've never given that any thought. I've certainly had clients who tried to trick the fair housing laws by having quiet swim hours so that the kids wouldn't be at the pool to annoy the older folks who didn't want it to be noisy. And that's a fair housing problem all day long. And I also think it's a fair housing problem all day long to have vulnerable swim hours for older folks. But having segregating people by vulnerable population, things like that, there's a fair housing advocate around every corner that's going to say that that's a problem. So as a matter of fair housing theory, I think there's a fair housing person out there who would have trouble with it.
Scott, this is another question. I'm sorry, go ahead, Wendy, and I think you're on mute. I'm not hearing you. Okay, go now.
So one of the things I will say, not to take issue, but really we're enforcing all sorts of rules and regulations at the pool all the time. Don't throw a ball, don't run on the deck, don't, so many things. I can't, and that is the culture there at the pool. For the greater good, we have to enforce rules. So I don't think that's so much. I think it's partially how you approach it. It's a friendly reminder. And then certainly I don't go up there and say, out. It's a quiet discussion and we're so sorry, but it's all in how it's framed. Never, we may carry a big stick, but we're talking very softly.
Hey, Ben, I have a question for you. So talk to me and to the group about some of what you're experiencing with smaller communities that don't have the resources that Wendy's community has and how they're navigating some of these issues.
I mean, right now, you know, considering most of the areas, the guarded facilities that we handle are primarily in the Northeast and the seasonal markets. We're awaiting the next, you know, we're awaiting direction. What is the, you know, I think Wendy was saying in Virginia, you know, we're expecting a statement in the next 24 hours, specifically on pools, which, you know, once we get what we can speculate the types of things that we're going to have to contend with. As to what will be required to open for use, we're not 100% sure what that is. So we're thinking about all these different things. conceptually, then we'll find out what the requirements are. And then I think because we've been having these conversations, because we've been looking at these strategies, we're going to be able to take that and turn it into something that's that is practical. So you know, some of the things, if we're expecting things about furniture, you know, as Wendy said, one of our thoughts was, okay, for some associations, the answer is remove the furniture. The pool is a place to come to swim. It won't necessarily be a place to hang out in, right? And that might be, you know, one of the ways that a more budget conscious community might still allow use, where, you know, because they don't want to take on the additional responsibilities and associated costs with taking care of the furniture. You know, that's really just one example.
So let me ask you, Scott, I think that in Arizona, there's no requirement for guards. There's no legal requirement for guards. So having these communities that don't have guards, who are going to consider these issues related to social distancing and maybe even ensuring that everything is tested properly, whatever it happens to be, how are some of the communities you're working with contemplating handling these issues without the guard and without the resources?
I think some will just open the pool and that'll be it.
And post signage maybe saying, here's what we're doing?
I don't even know about that, frankly. I don't know. I mean, as you know, because you spent time in this market many years ago, there are a lot of associations that operate kind of off the grid. They don't have a professional management company. They don't seek advice from CCAL law firms. They operate in a kind of vacuum, and they kind of do whatever they want. And when they're confronted with what the law is and what best practices are, they kind of act like they don't want to know, or they didn't know, or they didn't seek any information. And there will be associations that just, when the governor says okay, they'll open it and they won't give it a second thought. There won't be any signage, there won't be any waivers. The pool keys that always worked will just start working again, because the bike lock that was put on the pool gate will be removed because Bob, the president who put it on there, will have removed it. And so I think a lot of associations will act like none of this ever happened. And there will be some smaller off-grid management companies at the C and D level, if you want to treat them that way, will do the same thing. And so
it's the reality of some of these associations, right? They're smaller. They don't have the resources to hire the professionals to walk them through this. So hopefully this type of webinar will help give them some information to help guide them as they make these decisions. But do you think maybe just making sure that the board is evaluating the circumstances, looking at the can we legally open, should we, and if we do, how do we do it, and then communicate it with the membership, even if it's maybe not the most popular decision. If they go through those steps, document those steps, get the information out to their members, and post some signage, that might be what some associations are going to do.
That may be exactly what they do. And if I were on the board of an association in that circumstance, and I found out that there's no insurance for this, I would have a hard time voting to reopen it, knowing that the entire quantity of risk associated with this resides with the association in an environment where there's no commercial opportunity to shift that risk to an insurance company. And I'm repeating what I said earlier, but that's a very much a concern to me. It would be if I were a director.
Here's an interesting question, and whoever has experience with this. So I think that we all know if a pool, a homeowners association pool, allows a swim team to use the pool, that potentially creates that pool changing status from a private pool to a public pool, right? So say there's a pool that does that on a regular basis, and Scott, this is probably going to be for you, does that on a regular basis, but this year there's no swim team, and they don't open their pool up for that swim team because they don't want guests and outsiders in, and the locality has specific rules for public pools versus private pools, but they're not this year opening their pool up as a public pool. Do they have to comply with those public pool guidelines this year if they're not using it as a public pool?
Well, of course, it always depends on does the definition of public pool say if you've used it as a public pool within the last 36 months, then they would have to comply with it. But if it means you only have to be treated as a public pool if you've used it as a public pool within the last 6 months, then of course that wouldn't be true. So it sounds like a definitional problem, or it sounds like a question of what the definition actually says about how long ago you used it as a public pool in order for it to be treated as a public pool this season.
Here's also a good question, and Ben, maybe you can help with this. In some of the pools that you're working with that maybe have had swim teams, are they allowing swim teams this year to use their pools?
You know, I haven't gotten, I think that's a huge concern. And I don't know that there's been, you know, I was talking to someone that I know that's a coach in the Central Maryland Swim League, and I don't think they had gotten guidance in terms of how to run a practice. So, I mean, in a practice it is hard to get through an aquatic workout with, you know, I mean, usually our kids are like sardines in these, you know, you can't get the distance that you want in those situations. So I'm going to see a lot of swim, personally, a lot of swim team not. I also know that the definition of what's public versus private, state to state. I want to just hearing, oh, well, if I group in, we're no longer, you know, then now we're private. I can tell you in New Jersey, any pool that has over 2 families using it has to comply with the public recreational bathing code. So the definition, you know, even if it's a private community, if it's more than 2 units, they've got they're no different than you know, a big, you know, swim club. That's no different. Doesn't matter. So,
Wendy, when you talk about the no guest, oh, go ahead, Wendy.
There was one thing that popped up as a question that I neglected to mention. We're going to be providing our guards with gloves and masks at the entrance where they're in direct contact with the folks giving them the cards. So they'll have latex gloves and masks that we'll provide for them. We were able to procure a lot of gloves and masks. So we're lucky in that regard. And that was a question that had popped up.
Will you be requiring masks by residents at the pool?
My understanding is that if they're more than 6 feet apart, they don't need to wear masks, but that could change after tomorrow's governor's guidelines. So that would be
absolutely
very hard to enforce.
And Wendy, and maybe Ben, you've heard this, and maybe Scott, you've heard this. So if you're not going to allow guests, but there is a family that has a nanny, and that nanny brings the kids to the pool, is that nanny or babysitter or other caregiver, is that person considered a guest, or are they allowed under your guest policy?
You can get a pool pass if you can provide us with mail that comes to the address. So if you're a live-in nanny, yes, you can get a pass. If you're just not to minimize, but if you're a babysitter that lives elsewhere, you can't. But okay. I mean, they skirt this by using the wife's pool pass when they come in.
So we've gotten a lot of questions also about how this whole process can be applied to opening the health club or the gym and opening the clubhouse, etc. Wendy, Scott, what do you have? You don't have to get into it. We don't have the time, but do you have an initial thought that you could share on that topic?
I think it's all virtually the same.
Yeah, it is. The
It's
cleaning.
just going through
is
that
the
process.
same.
Can we legally?
Yeah.
I do think indoor clubhouses are different than an outdoor pool area. You know, there are a lot more surfaces and things like that, but can we legally, should we, and then how do we do it, right?
I want to just throw out there another consideration on those interior spaces in terms of like, you know, fitness equipment and those things. You have to use, you don't want to be using the same sanitizing agents on those as you would out in the pool area. I think the pool area is a lot simpler in terms of, you know, how you treat it. Some of those indoor surfaces, you know, if they have electronics and those things, you don't want to be putting any kind of chlorinated. There are specific agents that you know, for that.
Fair point. Fair point. Okay, here's what I'm going to do. I'm going to do a couple of closing comments. I'm going to share a video with everybody, and then I'm going to come back to you, Scott, Ben, and Wendy, and just ask you for 15, 20-second closing remarks. So I do want to thank you guys for being here, the presenters. Thanks to all of the participants who joined us today. Please keep this conversation going on CAI's Exchange. It's an online message board where you can have this conversation with 43,000 people from around the world talking about this particular issue and other issues that your communities are facing. Go to our webpage, you'll be able to find that. We talked early on about stay-at-home orders, CDC guidelines, the White House plan. All of those documents are on our website specific to your state. So the state stay-at-home order, you'll be able to find out a link to that, find a link to that and information for your state. If you go to caionline.org/coronavirus, you'll find government actions related to community associations. CAI developed a commercial that we have been distributing in honor of the community association managers, board members, and professionals that have had to, in these crazy times, just lead their communities and kind of as they could, right? You guys are out in front, essential workers, going to these communities, trying to do your best to lead, while Scott mentioned earlier, trying to balance the interests of the people who don't want that pool to open and the people who think that that pool has got to be open. Leadership counts, and that's what you guys are doing now. You're all amazing, and CAI stands by you in these challenging times. So I wanted to share this video with the group in your honor. All right, as promised, I am back. Scott, let's start with you. Closing remarks. Thank you so much for being here.
My final thought is to remind everyone that the inability to find insurance has nothing to do with whether you could be liable for something that might or might not be covered by insurance if you could get it. And that's my number one concern for associations, is that recognizing that you might not be able to get insurance for something doesn't mean that a jury couldn't find you liable anyway. And that's the concern that I have for a lot of associations going forward.
And I'm going to actually queue up and let people know that next week's webinar is on insurance issues. and community associations in COVID-19. So you'll see a notice about that on Monday. Scott, thanks for being here. Every time you said here in Arizona, it made me miss you and miss Arizona and my amazing 12 years that I spent there. So thanks for participating and thanks for joining us today. Wendy?
My advice is that plan and then plan some more and then be ready to throw your plan away and start from scratch, because this is an ever evolving situation and it's different for all of us. The only thing that's the commonality is that
we know that our plan's going to change a bit before we actually open any pools or not.
Absolutely. Thank you. Thanks so much, Wendy. Really appreciate you being here. Ben?
Really just that maintaining your pool is essential to health and safety of the community, regardless of whether it gets open for use or not. And it's also essential to preserving the physical asset. We have a responsibility for the residents to come, that the asset is there for them for many years. How we navigate this situation is obviously essential to customer service and essential to our reputation in the industry and the reputation of the communities we serve.
Oh, you couldn't hear me. I was saying, Scott, Wendy, Ben, thanks so much for taking the time to be with us, sharing your expertise. For those nearly 1,000 people who joined us today, thanks for being with us, and thank you for doing your part to building better communities. Have a great day, stay healthy, stay well, and stay in touch. Thanks, everybody. Bye.
Thank you for putting it together.
Our pleasure. Thanks.
Thanks, Dawn.
My pleasure.